Brain imaging methods have been with us for more than a decade. And one of the advantages of this long time that we've been using brain imaging is that it supports quantitative meta-analyses to answer questions about the magnitude of the relationship between measures of brain structure or function and mental illness. Major depressive disorder represents one of the syndromes where there is a particularly rich brain imaging literature, and Gray and colleagues present results from a meta-analysis that examines aspects of brain structure and function in this syndrome. There's been somewhat of a back and forth in the literature in recent meta-analyses, with some suggesting that there are clear relationships and others suggesting that such relationships may not manifest between the diagnosis of major depression and either brain structure or brain function. Gray and colleagues go somewhat further along this path to suggest that when important methodological caveats are considered, we may in fact see such a relationship. So for clinicians and scientists who are interested in coming away with an overall message, Gray and colleagues provide a particularly helpful set of insights on the relationship between brain imaging findings and the diagnosis of major depressive disorder. A series of genetically focused studies have taught the field tremendous amounts about both environmental and genetic risk for major depressive disorder. And Kendler and colleagues report new findings that shed light on the nature of this underlying risk. They use a fascinating design that makes use of both data on familial aggregation as well as adoption to tease apart the genetic and environmental risk factors related to depressive illness. And the most important insight to come out of the finding is to highlight the important role of the environment in creating risk for depressive illness. And this should increase clinicians' attention to what are the various environmental factors that we might intervene upon to reduce this risk.